Hey Scott, this is Stringer. This is the inside of your right knee. You'll see this little tube right here. This is about a little bit smaller than a straw. It's a sterile metal tube that's going into your knee. We're running sterile water into your knee, and this is through the incision on the upper aspect of your knee. This white thing that you see here on the top, that is the backside of your kneecap. And that is supposed to look like a white cue ball. It should look like marble. And you see that kind of frayed tissue right there. That's on the inner aspect, what we call the medial side. And there's the front of your thigh bone down below it. And right there, the cartilage doesn't look too bad. That white stuff that you see in the bottom of the picture is the surface cartilage on the end of your thigh bone. And that's the surface cartilage on the backside of your kneecap on the inner aspect. I can kind of sit there and just push in here with my finger so we've got your knee full of fluid. The problem I see is when we come back, yeah, you've got this right here, but when we get over here, do you see the transition between kind of frayed looking stuff and then here? That's bare bone, and that's on the back of your kneecap. And you see the transition between the frayed surface cartilage there and this bare spot, and that's on the back side of your kneecap. And you can actually see kind of a hump in the bone on the back of your kneecap. And I'm talking about this. This is the kneecap up here. And this is the cartilage just kind of just on the transitions a little loose. And then you see the same thing down here. This is the front of your thigh bone where the cartilage is missing, and you have this exposed what we call subchondral bone. So that's bone up there. This is bone down here. And if I bend your knee's out straight now, and if I bend your knee, you see the difference where you've got this more normal looking surface cartilage, especially right there. You can see it kind of split and crack there and peeling off here. And then you see the normal stuff here, and this is what we wish it looked like all over. And this is what I was telling you before. I wish we had some kind of a Bondo or some kind of a spackling compound or a laminate or something to put over the top. So we're going to clean the edges of that. The other thing is if your kneecap was hanging over, based on the fact that this is on the outer aspect of your kneecap was sitting kind of cockeyed in this groove, I would release some tissue over here. But you're really not doing. We'll look at that a little more as we go through this. So that's me bending your knee up and down. The kneecap's above, your thigh bone's down below, and we're going to kind of sweep over this side. This is on the inner aspect of your knee, and you can see a spur right there too. And it doesn't really change anything to try to take that spur off. But that's normal cartilage, and that little thing you see there that is extra calcium that's not supposed to be there. If I move this thing down, you can see three of them. So you got one there. Another one here, another one there, and you got one here, and that's on the inner aspect of your knee, what we call the medial side of the knee. So if it looks like cauliflower sticking out, that's actually a spur that is sitting off the end of your thigh bone on the inner aspect. Again, I come right up here and touch that area, and that's on the inner aspect. Sometimes you'll get a thickened scar band that as a result of that we'll take out, but you really don't have one in here. It's something called a plica, but you don't have it, so there's nothing we need to do there. If I come down in here, now I'm going to look at where the two bones come together. Your upper leg bone is this thing that you see on the top. Your lower leg bone's down here. Your cartilage pad, I'm going to kind of move over this direction and come around a little further in the front of your knee. That's your inside cartilage pad that we call the medial meniscus. This is the top of your shin bone right here that we call the medial tibial plateau. That's the top. That looks fine. And here's the problem. You come up here, normal looking cartilage there, and then you see this where it's trying to kind of come off the end of your thigh bone there, but not anywhere near to the degree it is on the back of your kneecap. That's on the, so if I move this up and down, that's thigh bone up above, shin bone down below. Sweep over to the center. This is your anterior cruciate ligament knee. We come across this way, you'll see it better. That's your ACL. That's fine. No signs of an injury to the main ligament inside the knee, which is right there. And now we're going to go look towards the outer aspect of your knee where the two bones come together. Excuse me. This is your thigh bone up above. That's your outside cartilage we call the lateral meniscus. This is the top of your shin bone on the outside. And that side doesn't look bad. So between the two bones on the outer aspect of your knee, that looks fine enough as I'm knees more straight here. Here's your knee bent. That cartilage pad looks good all the way around. No signs of a tear. Maybe just a little scuffing there. Okay, so you're going to see a needle come into your knee. We're going to use that to define where I want to make my third incision. You've got a very long leg, so it's going to